this is a misconception that both patients and physicians have, that like that's the physiotherapy, that's what works. But yet, if you look on, do a literature review on PubMed, right, and look at the efficacy of TENS, ultrasound, all that shit, none of that works, man. It's good for addressing patients' pain symptoms. But listen, man, I'm not in the business of fixing pain. Like, it's not that I don't care about it. I do. But I'm in the business of fixing function, right? Getting people to be able to bend, to move, to lift, and generally speaking, when you address the function, the pain relief comes along, right? So stop chasing after the pain. And like I have so many physios, even still to this day, tell me, oh, I'm giving the patient some this and some that. And I'm like, okay, let's break this down to first principles. Okay. If I do a surgery or you become injured, there is a certain amount of muscle loss that is going to occur as a result of that. And I've heard estimates, although I haven't actually seen a literature source for this, but I've heard estimates that you lose muscle strength and mass at a rate of approximately 1% per day. Okay. And so if that just means, like, if you were immobilized for 2 weeks, that's 14%. Okay. Which means that there is a deficit that needs to be restored. Okay. And it's a deficit in strength. It is a deficit in muscle mass. And then anytime you're not using a muscle, it's going to become more stiff, right? It's just not going to maintain its elasticity during that time, largely because you're not using it. So we've established there is a strength deficit, there is a mass deficit, and there is a flexibility deficit. I challenge anyone to show me what ultrasound machine, what TENS machine, what any machine, laser, like whatever, is going to restore any of that, right? And so from my point of view, stop wasting your time. People don't have the money for us to waste their time, right? So they don't have the money for that, and people just frankly don't have the time for that, right? So stop wasting their time. Muscle flexibility and mass deficit, correct those things. And the way that works is by getting into the gym. And I credit my experience as a trainer and as a fitness instructor with having that knowledge. And I think that's the thing that allowed me to kind of put these two together and go, that's not rehab. This over here in the gym is rehab. And this is what we need, right? And I, as the surgeon, should be able to recognize that and then appropriately guide my patients and their therapists to understand that that's the path that they need to go down, right? And so it's our job to be able to lead them in that.